Thank you for your interest in the 2019-2020 Lucas County Community Health Assessment. My name is Emily Gensler and I'm the project manager and work for the Hospital Council of Northwest Ohio. If you started here to review the Lucas County child data, I wanted to start off by mentioning there's an additional presentation posted to review the methodology of the Community Health Assessment. For example, you'll find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on the child population, which encompasses ages 0 to 11 years old. Parents were targeted for this specific population to report out on their child's health. Please check out additional presentations to review the adult and youth portions of the assessment. The full report can be found on Healthy Lucas County's website at healthylucascounty.org.
In the child portion of the assessment, you'll find the sections shown on this slide. As a reminder, this data is reported from parents of children ages 0 to 11 years old. As you can see, there are also specific sections for children ages 0 to 5 and children ages 6 to 11. The additional sections that you see in the slide encompass that full population mentioned of ages 0 to 11. Also, I'd like to mention that the full Lucas County Community Health Assessment is over 300 pages. We will only be touching on a few data points from each section to give you a general overview of the type of data that you'll find in the full Lucas County Health Assessment. Our first section for child health is health and functional status. We have information on nutrition, weight status, and physical activity data. Overall, 16% of children were obese and 9% overweight based on body mass index. Our statistician is able to calculate BMI based off of children's height and weight, which is of course reported by parents. 30% of children ate 5 or more servings of fruits and vegetables per day, with only 1% reporting 0 servings per day. Lastly, we have children spending the most time watching TV or reading during an average day of the week. On the next slide, specifically looking at asthma, 7% of parents reported their child had an episode of asthma or asthma attack in the past year, which you will see a 5% increase for those with household incomes less than $25,000. We also have lead poisoning data, which asked parents if their child had been tested for lead. 41% reported their child was tested and the results were within normal limits, and 14% did not know if their child was tested. This is our first comparison table for the Lucas County child population. As you can see, this is 0 to 5-year-olds, which the next slide will break down 6 to 11-year-olds for the same exact indicators. To explain this comparison table a bit, the first 2 columns that you're looking at is previous Lucas County data for 2014 and 2017. And then we have our newest 2020 data. And then the last 2 columns are showing data for both Ohio and the United States, so we can compare Lucas County's data. The table specifically, again, for 0 to 5-year-olds, we can see 0% being diagnosed with anxiety and depression during the last round of Lucas County's assessment, and now we can see the increase in both of those categories. This is also similar to those diagnosed with behavioral or conduct problems. We also see more children in this age group seeing a dentist within the past year, with a higher percentage than both Ohio and the United States data. This slide has the same indicators, but looking at the 6 to 11-year-old age group. We see similar trends for the depression and anxiety indicators, with an increase since the last assessment, and also a higher percentage than the state and national data. Additionally, you can see ADHD diagnosis almost doubling from 2017 to 2020. Next, we're moving on to the child healthcare access section, with 1% of parents reporting their child did not have health insurance. Looking at the second bullet, for a primary care provider, 84% are reporting their child had 1 or more people they thought of as their child's doctor or nurse. We have some trend data coming up for that specific indicator. Our last bullet's indicating what's preventing their child from getting all the medical care they needed, and the top response, most parents reporting cost as the main reason their child is not getting medical care. Next, we have parents reporting more than half of children had received a flu vaccine in the past year. The top reasons that children did not get all of their recommended vaccinations was because they had received some, but not all recommended vaccinations. You'll also see 1% for the rest of the responses in this list. We have the comparison tables for healthcare access on this slide, with the top comparison table depicting 0 to 5-year-olds. For both comparison tables, we have Lucas County children having a personal doctor or nurse much higher than Ohio and US comparisons. Additionally, those having problems paying for their child's medical bills were much higher for Lucas County parents than Ohio and US data. This is looking at specifically the 0 to 5-year-old population. We are now moving on to the 0 to 5-year-old specific section, which is early childhood. Parents were reporting different ways they put their child to sleep as an infant, with 90% saying on their back, which is the recommended method. Mothers breastfed their child at the following lengths, depicted in the bottom bullet, with 24% saying less than 3 months, and 16% reporting they never breastfed. Our comparison table at the bottom of the slide is showing a decrease in those never breastfeeding their child. This indicator is also lower than the state and national comparison data that you see on the right-hand side of the table. More Lucas County parents are also reporting putting their 0 to 5-year-old to sleep on their back, which was almost a 10% increase since the last Lucas County assessment. During their last pregnancy, 94% received prenatal care within the first 3 months of their pregnancy, and a third of mothers had children less than 27 months apart. Now moving on to the middle childhood section, which pertains to those ages 6 to 11 years old, we have more than 3/4 of parents reporting their child was physically active for at least 60 minutes on 3 or more days per week. 3% of parents reported their child did not engage in any physical activity in the past week. Regarding reading frequency, we are looking specifically at reading outside of school. Most parents reported their child read almost every day outside of school. More than 1/4 of children ages 6 to 11 had a social media or other virtual network account, and 78% of parents reported having their child's password. 4% reported their child had a problem as a result of the account. The bottom of the slide has our comparison data with the majority of 6 to 11-year-olds participating in one or more extracurricular activities. The family and community characteristics section of the child report is pretty large and has a variety of topics. First, we're looking at parents reporting their child was going to bed hungry, with 5% reporting their child went to bed hungry at least 1 day per week because they did not have enough money for food. This more than doubles for those with annual household incomes of less than $25,000. Another large topic within this section is childcare. The second bullet is depicting 15% of families with annual incomes of less than $25,000 reporting they had to quit a job, not take a job, or change their current job due to childcare concerns or problems. Next, this slide is looking at adverse childhood experiences, which we use the acronym ACEs. These are potentially traumatic experiences in a child's life that may lead to negative health outcomes later on in a child's life. The most reported adverse childhood experience was parents becoming separated or divorced, as well as children living with someone who is mentally ill, suicidal, or severely depressed. 7% of children were experiencing 2 or more ACEs. Our next slide for family and community characteristics. The first bullet is depicting those with firearms in or around their home. No parent was reporting they were unlocked and loaded. Lastly, we have 7% of Lucas County parents reporting someone in their house used cigarettes around their household, potentially exposing them to secondhand smoke. For our family and community characteristics comparison table, for 0 to 5-year-olds, we see an increase in those eating meals together as a family every day of the week. Also, we have data depicting neighborhood safety, with more parents reporting their neighborhood is usually or always safe. Unlike the previous slide, we are looking at 6 to 11-year-olds in this slide, and those eating together as a family in this age category has declined since the last assessment in 2017. We have a lower percentage in Lucas County experiencing 2 or more ACEs than our national and state level data. We look at parent health as our last section in the child assessment. Parents felt challenged in regard to the day-to-day demands of raising children, with 44% reporting challenges related to multiple children, and working long hours was the second highest response at 20% of parents. This changes based on income, with almost 50% of those with lower incomes experiencing more than one difficulty. Our comparisons for the parent health section is looking at how parents rate both their mental and physical health. Both poor mental and physical health for mothers of 6 to 11-year-olds is increasing since the last assessment, and the percentage of fathers rating their physical health as poor increased as well. We thank you for your time and your interest in the results of the child portion of the Lucas County Community Health Assessment. Please remember to review additional sections of the presentations that you might be interested in, and that includes the adult and the youth-specific sections. Of course, also feel free to check out the full report on Healthy Lucas County's website. Before we finish, I also encourage you to fill out a participant feedback survey via SurveyMonkey, with more information coming up on the next slide. Here you will see a link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the Executive Committee of Healthy Lucas County to move forward with planning for the next Community Health Improvement Plan, which is the next step in this process. Thank you so much for your time.